let's see, I'm 41 years old, and I think my history of sport encompasses almost all 41 years, starting maybe at 39 years. Age of 2.5, I started playing tennis and hockey. My dad was a tennis and hockey coach, and I guess from the get-go, as soon as I could walk, I was on skates or I was hitting a tennis ball. So that's my all-encompassing history of sport. I was a player first, for the first, say, 25 years of my life. After that, I worked a little bit in the business world and went into coaching. As a coach, I'm still very active with my players. I play all the time with my players, or at least I used to. I've coached high school hockey as well, so I would say I'm still a very active participant, players coach, and a hands-on type of coach. I developed injuries from repetition. I mean, repetitive shots or repetitive motions for a tennis player are what cause breakdown in the tendons, ligaments, and the joints. And really, most of my injuries from sport are from tennis. Hockey, I've lost some teeth, banged up my shoulder, my knee, but for the most part, my body has, from repetitive use, especially coaching the last 10 to 12 years in tennis, has really worn down my tendons and my patella tendon, my elbow tendons, shoulders as well. I've developed some heel spurs in my feet, and just the wear and tear over the years, like a car that breaks down. Being here at Georgetown University, it made it a little easier for me to be able to come right here on campus and go to physical therapy. And it started with my injury last year to my right elbow, which I've never had. And all of a sudden the light went on and said, hey, this is my profession. I need to work on the side of my profession so that I can continue to coach and be a player's coach and be a hands-on type of coach. So that's where I made that first move towards physical therapy. And because of that, I would say over the last 6 months of being in physical therapy, it's helped me. It's helped me be able to play a little more, which I love to do. It's a sport of a lifetime also. So I think that continuing with physical therapy is something that I need to do just in a rehabilitative way, not just to treat injury. Preventative medicine. And it's been very successful, not only with myself, but also with some of my players. Changes, they were out there playing. I mean, back in the fall when Will Lowell and Kevin Walsh got their injuries, they were playing and then they were taking a day off, and they were playing and they were taking a day off. We're a Division I program, and taking days off is usually not not common in Division I tennis. And we have guys that need to get better and they want to work on their games and improve. They're still young enough to do so, and but the injuries were really putting them on the sidelines and setting them back. So with physical therapy, they've been able to treat their injury and play at the same time and get better. And that's what it's about. As a coach, I want to see my guys get better. I don't want to put a Band-Aid on something and then put them back in the lineup. I want to see them get better so it doesn't happen again. I think the series is anytime you can provide structure, especially with a young student athlete, that works the best. If you give them some exercise and say, hey, good luck, it doesn't work. They're too busy, they're studying, they're playing, they're competing, they're socializing. It's too much. When you give them a structured series like you have, it really breaks it down for them of what they need to do so that they do not get injured in the same way as they did before. So, having that structured series was very, very important.
I've always been very tight. I've always been in shape as far as cardio goes, been trying to keep muscle on, but the nagging problem for me has been soreness creeping up in certain areas, or having minor pulls or twists just because the smaller muscle groups that have been a problem for me. So I've had problems in my shoulder, my lower back, my upper back, and my elbow, a little bit of my wrists my whole life. But those are not really problems that I've been able to address through my cardio training and through my weight room training. So I've had to deal with those for most of my playing career. I've been able to deal with things that in the past have just had to live with on the court. Now I've been able to face them head on by going in, doing the exercises. I've been able to address the pains inside of my elbow, the weaknesses in my shoulder that I didn't even know existed that were contributing to it. So I've been able to loosen up in areas that have been tightening and putting stress on my body, and I've been able to evaluate where the sources of the problems have been. So I've been able to, I feel, address problems even before they've come up. Since I've started training and doing the exercises, I've been virtually injury-free, and I've been able to train every day, which is a big blessing for a tennis player, because being kept off the court due to injuries can kill you. Once I went in, I was able to go into your office and do a evaluation, quickly identify where the sources of the problems were. And from there, we were able to map out a plan as to what I needed to do and what we needed to do together to address the problems, and also to do things as far as prevention so that these problems didn't occur again, and so that I was able to be aware of what was going on in my body during matches, before and after matches, just to preserve and be able to move forward injury-free. Serving's a huge part of anyone's tennis game. Men's tennis is all about your serve, and for me, it's one of my biggest weapons. And I spent months not being able to use it, and more than that, actually having it hurt me. And every time I would try and hit my serve, feel the pain, affect the way that the rest of my game was working. Since going to physical therapy, I've been able to use my serve. It's been my biggest weapon, and I can hit it with the confidence that I didn't have before, and the comfort and that's been really important for me in order to compete at a high level. Physical therapy has helped me go on the court every day without being afraid of what might happen to my body if I do the wrong thing to it. I'm confident going out there every single day, knowing that I'm in control of my body and that it's not going to act up and take me out of the sport that I want to be playing. The confidence and the comfort that comes with that has been incredible. I've had great experience with my training since I've been going to the physical therapy, because I haven't had to worry about the things that every tennis player has to worry about every single day.